Hello, and welcome back to the Home Sweet Healthy Homes podcast. We're super excited to be back here after our brief little hiatus that we had. This is a super exciting episode because today is the first day of Community Development Week, which is super exciting. We love having these different theme weeks and showing what community development has done for our city, more specifically in Quincy. And we do have Rhiannon here to talk all about CDBG. Hi, Rhiannon. How are you?
Good. Thank you, Kate. Kate kind of mentioned this is the kickoff to our CD Week, which is part of the National Community Development Week, which really highlights the money that it provides to different entitlement cities and smaller towns, benefits a bunch of communities in a bunch of different ways, from housing and economic development and things like public and social services. So this week we're really highlighting our public and economic partners, the work that they do in the city and kind of how they utilize the funding that the city provides to them. So as Kate mentioned, today our kickoff is with Quincy College. Quincy College is probably our biggest economic partner through CDBG funding. We have an agreement or partnership with the Workforce Development Office at Quincy College, and we provide them tuition money for 3 different programs that they offer. That is the CNA Medical Assistant Program, the Substance Addiction Program, and the Farm Tech Program, and we have Charlotte today to talk a little bit about that program. And that funding is allotted towards students that meet the requirements that the college and the city has kind of set aside to receive this funding. And it is earmarked for low to moderate income individuals that are looking to get into one of these programs. One of the great things about this program, aside from providing tuition assistance to students that wouldn't otherwise qualify, is that there is a guaranteed jobs outcome, meaning that in order for the college to receive this money, they do have to guarantee to us that a certain amount of full-time jobs will be provided for these students when they complete their program. So usually that results in any of the partners, but especially Quincy College, having some sort of system already set up that when the students complete any of those 3 programs, there is employment waiting for them. So that is the main goal, so that the funding will be used to put people in sort of career paths when they finish.
And so you mentioned that the CDBG, Quincy College, the biggest economic partner. How much of that funding goes directly to the students in this Farm Tech program?
All of it. So all
Awesome.
the money that the college gets is set aside specifically for tuition, fees, and books and supplies for the students. So all of it goes directly towards student tuition, which is really nice. And I do want to mention for the Farm Tech program specifically, which is the one that we're highlighting today, since that program at the college has been receiving funding, they have had 49 students that have received full tuition, fees, everything to complete that program. So that's
Great.
A really good number.
Awesome, yeah. And more exciting, we do have Charlotte Hook with us, as Rhiannon mentioned, to talk all about the Farm Tech program. So if you're interested, or maybe you know someone who may be interested, this is definitely an episode to listen to. How are you?
I'm good. Thank you for having me.
Good. So could you talk a little bit about the Pharmacy Tech program and how you got started in it?
I'd be happy to. So our program is 120 hours of theory training over a 15-week period with an externship at the end. About 4 years ago, before I became the instructor, we still are really, we're in a very large technician shortage, not just in Massachusetts, but nationally too. I think at the time I was told we should expect to see this shortage for like 7 years, and it really has increased, partially due to all the advanced roles that technicians have now. We're not becoming technicians as quick as the roles are developing, so that's been a big problem. You know, there's lots of places have started to hire technicians to do jobs that previously they wouldn't, like, Pharma is hiring technicians, so that I'd lost a couple people to Pharma, which I'm happy for that. So I got into the program that way, really. I was looking for an avenue to kind of rebuild our workforce. So this is like one way that I thought that I could positively contribute.
Great, awesome. And so with this program, what do you think what certifications or expectations can students have going into the Quincy College Farm Tech program?
Certainly. So our program is designed to, the end of it, the students are going to go into pharmacy positions that are meaningful. The goal is for them to be certified. I consider myself to be a career pharmacy technician, and that's, kind of the path I'm putting them on right now. I find that pharmacy is very low barrier to entry, so this is a great foot in the door into other healthcare professions. But my goal is at the end that the students have the knowledge to pass the certification exam, that they are put in contact with potential employers. We will make sure that their resume is polished, help them write nice cover letters, give them some pointers about interviewing and things like that, so that they can go and, as I said, gain meaningful employment and enjoy this profession as much as I have.
Great, and they can feel fully prepared to kind of go into the real world. And do they get jobs right after, I guess, graduating or completing this course?
Yes, the job market for us is still so good that we actually start applying for jobs before the end of the course. Our organizations have, some of the larger pharmacy organizations have very long hiring cycles, and the last thing I want is people waiting 3 months for employment at the end. So last week, one of our prospective technicians just accepted a position at Stop and Shop.
Awesome.
So it's cool. They're going to work around their schedule to finish class, because that's the best opportunity for them to get certified.
Yeah.
But that tends to be really common. We'll start applying early on. Even if it's just they want to go shadow somewhere for the day.
Yeah.
I've had people request to shadow areas where they can see, veterinary pharmacy and things like that. So every Wednesday I try and have guest of the week come, who's a technician that's working in the field in a specialty area.
Yeah.
So they can kind of really get an idea of where they want to work. Some of them that have a real affinity for medication, maybe they're going to go be medication reconciliation technicians in an ED somewhere.
Yeah.
Or if they're interested on, they want to work from home, helping out with prior authorizations. These are people I'm connecting them with that I've offered to mentor them afterwards or be sources of contact or point them in the right direction for positions. So I'm hoping that they leave with the tools and the contacts, and they know they can always reach back out to us if they need to.
Right. As you were just talking, I honestly didn't even realize how many different, I guess in my mind, it just, the pharmacists that you see when you're going to pick up your prescription, but I feel like you just named off 3 or 4, which shows that there's so many different areas and things that you can do within this course right at the end of it, which is pretty cool too, and something that I didn't really think about.
Most of us are familiar with the technician that's with the pharmacist in the outpatient pharmacy, but that's really common in class. The first lesson is, where do we work? And they're always really, surprised to know some of the things that we can do and some of the areas that we can go into.
Right? No, cool. When you were saying the veterinary pharmacist, I was like, so true that obviously dogs get prescribed prescriptions. I know my dogs have, but I guess it doesn't even occur to me, which is really cool. And so you said that they need to get some experience prior to graduating. So what's that process like? And is that something that you help them guide through? And do some students, do they keep that experience and it leads to a full-time job at the end?
Yes, so there's really 2 components to this. We work them through. The first one is to be registered with the state of Massachusetts. If you'd like to be registered with the state, there's a few different pathways. One of them is completing a board-approved program. The programs there's lots of good programs in Massachusetts for pharmacy technicians. Some of them choose to be board approved and some of them do not. For us to be considered board approved, the students have to complete 120 hours of theory and a 120-hour externship. So if they are not able to complete an externship for some reason, maybe externships like to have people during the day, Monday through Friday, but they have enough people to support training. So maybe this person can't. Maybe they have childcare or things like that. It's not completely necessary, really. They can have a certificate that says that they completed the theory part. They're still eligible to sit for the PTCB, the national certification. They're still eligible because we are a pharmacy technician certification board program too, without the externship part. So they can go and they can get certified, and that also is a pathway to being registered with the state. They just can't technically call our program that if they weren't able to complete the externship. Which happens.
Cool. And so what are some of the, I guess, two-part question. What is some of your favorite courses to teach? / what do you think the students like the most? And what do you think are the most valuable and key courses that are a part of the program?
Yeah, I think it really depends on the student. Pharmacy is really highly regulated, so we spend a lot of time talking about law. That's kind of, middle of the road for excitement. The exam is also 40% drug, so some of them really are interested in it, and they'll ask me lots of questions, and they'll send me articles that they've seen about drugs, or they'll tell me that, my father has COPD, and now I understand some of his medication a little bit better, or thanks for getting me interested in about something that I didn't know about before, and things like that. So drug can be popular. Math is the least popular. So
Not surprised by that.
Yeah, we do that at the end, just make sure they all come back.
Right,
Otherwise
right.
they never would. My favorite thing to teach is cultural competency in pharmacy because it's not a common course. It's not in our textbooks or anything like that. But I feel like sending the students in with that kind of a background, they're the best opportunity to change our workplaces.
Of course, yeah.
So I like to teach that the most.
Yeah. And do you find that some questions, like, do you ever get truly stumped by any questions that the students, will ask, or maybe it changes like your point of view just based on like how they're understanding and relaying the information back to you?
Yeah, I mean, that's really one of my favorite parts of the class is they do ask me questions, and it's things that I've never even thought of.
Yeah.
And I call it Charlotte's homework. So I'll do some research for them and I'll find out. And it could be anything. It could be if somebody gets a pacemaker, do they take less medication then? Or, how do people that are kosher take medication? Does it affect them? All kinds of interesting questions. I'm not an expert, but I go and find someone that is familiar. So I usually go off and find them. We'll start the next class off with, here's my homework. They're really interested, but it's impossible to know every facet of every medication. And even pharmacists don't know everything about every medication. They're just taught how to find the information. So I don't expect the students to learn every facet of medication either. But I do get some really great questions that I'm like, I've never thought about that. I've never thought about it.
I know. I feel like that always, that's always kind of like funny, but it's also nice to learn new information too, because you're like, wait, that is a very valid question that I don't know the answer to, but I'll get back to you with that one.
Sometimes I've added it to my content. It's really good.
Yeah, no, that's awesome. And you find that with the students, going back to that externship, you find that the students, they are balancing the coursework and that externship, pretty well. Do you find that they, as they're in their externship, they're learning and understanding the topics that you're teaching in the class kind of at the same time?
I hope to. I mean, the national certification exam is really retail pharmacy based. So those technicians that are in the retail community pharmacies. So if our technician goes to an inpatient pharmacy, they may not see like things that are exam content.
Sure.
But what I'm hoping is that they are seeing what it's like to be a pharmacy technician there, maybe finding a setting that they like, meeting some pharmacy technicians, asking them questions. It's also, most of them will have a spot open either at the time or by the end of the externship. So it's like a nice transition into full-time employment if they, enjoyed the place that they're completing their externship. So it's like a friendly, it's a very long interview, really.
Yeah, of course. And as you mentioned earlier, you want all the students to be well-rounded too with all of the different areas, and by maybe, completing some of the other, I know you said it's rarely retail-based, but completing an externship that is maybe slightly different than retail, they can kind of get a gist of everything and then have a better understanding of maybe what they want to go into after by doing that too, which is pretty cool. And so, are you aware of any of the admissions requirements that you need to have before going into this program? Is it something that right after high school you can go into? Do you want to explain a little bit about that?
Sure. Our requirements really just line up with Board of Pharmacy. So Board of Pharmacy requires you to be at least 16 years of age. I don't think I've ever had anyone younger than 18 yet, but you're welcome to join me if you are. They have to be over 16, they have to have a GED or a high school diploma or some equivalent. And they have to have good moral character. You're basically, when you're getting your trainee license, you're signing that you have good moral character. So those are the requirements. I know that, it's very different depending on which program you take in Massachusetts. I think that ours is very, again, like low barrier to entry. We're willing to be flexible with students.
Definitely.
I have some of my students, I've only been in the States for like 6 months and things like that. So I think that we really will work with anybody that has a passion for this kind of material.
Of course, yeah. And what do you think are some of the advantages of being a pharmacy technician right now?
I would say we're essential. AI is going to be huge in our field soon, but it's not going to replace technicians.
Exactly.
Can't. We have a lot of automation. We have a lot of robots that we're using. But we all need a technician to feed it and work with it. So instead of that, we're now becoming the people that, work in informatics to help run some of those things too. So it's just been a very, very rewarding field for me. It's continually evolved. I've always been I've been doing this since 2002. So I've always been, really interested in all the fields and be able to work my way into different areas and things like that. There's really pharmacies for everyone. There's like something for everyone. If you are very gregarious and you want to walk around and meet a lot of people, we have that. If you want to work on your own work, in your own space, we have that.
No, that's really cool. And I think that's a really valuable point as well. While a lot of jobs, can be taken over by AI and the computers and whatnot, but the pharmacy, and that they need an actual person to be there to separate and create the different drugs that we use. And what type of AI programs do you guys, or do you think will be used that will switch over to AI in the future?
Yeah, I'm not really sure. It's really so far out for us, I think, right now. I've heard about other health professions that are using it to, read things, but it's tough to really rely on that.
Of course.
It's tough to really think of something that's going to pass the clinical judgment of a pharmacist.
Right.
It's really hard to think, but I hope we see some good developments. I hope we see good things for, patients, but we'll see.
Is there any sort of supports available for your students who maybe are struggling, falling behind in this program, or is this something that maybe you're willing to meet one-on-one with them to help them be successful in this field? What kind of support systems are in place?
So because we are, our base is, applying with the Board of Pharmacy requirements, so that does leave, a lot of room. We'll have some people that have, I have people in my class that have never had a job before, and they're nervous about just joining the job force, or, maybe they've had jobs, in the past, but they've been raising their children and they're coming back into class. A lot of times I'll have very large differences in aptitude. I'll have people that have no basis, and then I'll have other people that are CNAs, so they really have a head start. It's one of the challenges, really, of keeping everybody together.
Right.
So sometimes that does require meeting outside of class and covering topics again that didn't land. We do a midpoint quiz halfway through, and that's really for me. I tell them it's a quiz for me. Don't get worried about this. Is for me. I just want to know where you're at. What I need to go over again that didn't resonate with you. So don't stress out about a quiz. It's really just to help me figure out where we are and what we need to focus on, or what we need to go back and review. But it is really, that's the tough part. There's really such different aptitudes sometimes.
Yeah.
But we manage.
Exactly. And so this is a 15-week course, I believe, as you mentioned. And so is there homework going on in this? So there's that midpoint quiz. Is it based on a test system as well? Kind of how does the course load look for the whole 15-week course?
Yeah, as I mentioned, the certification exam is 40% drug. They have to learn the top 200 drugs.
Yes.
They have to know them brand and generic.
Okay, so a lot of memorization.
A lot of memorization. So their homework is usually focused on that. Every week we do a quiz on whatever we covered the week before. And I don't collect that. That's for them to see where they're at and what they need to go over. Part of that will be, picking drugs that have certain characteristics, or matching brands to generics and things like that. But every week I don't collect those, so there's no pressure. I'm not, I'm not going to see it. Just, at least have a guess.
Yeah.
So we do quizzes every week. We do the midpoint. The homework, like I said, is just really going over the material for the week. There's really not a lot.
Yeah. But over the course of that 15 weeks, you do need to know those 200. So yeah, it definitely, I feel like that's an added benefit that there isn't homework. It just, make sure that you're aware of these, make your flashcards.
Exactly.
Kind of just go over them if you're just at dinner, or maybe during your lunchtime.
Waiting for the kids to get out of school, just flip through your index cards.
Right.
There's a lot of outside of what we do. I tell them, you're not going to learn drug in class. You really have to put in the effort to do that yourself.
Yeah, definitely. So we were talking about AI maybe in the future. Do you have any other, ideas of how your role, or just, pharmacy and pharmacy tech as a whole, is going to evolve in the next coming of years?
I think that we will probably move into some clinical functions.
Yeah.
There's already, not in Massachusetts yet, but because we need a pilot program, someone needs to start it. And maybe it'll be me one day. I just haven't cleared the time for it yet. But there's other states where we have pharmacy technician check pharmacy technician. Tech. And it's pharmacy technicians that are checking other technicians' work, and it doesn't go through a pharmacist at all. And it's usually refills. It's something the pharmacist is already deemed clinically appropriate. We've already filled it once. We're just refilling the prescription. All the technician is doing is matching the name on the label to the product and attaching that.
Sure.
So, that's huge for us, So there's a term, scope creep, which usually means someone's trying to get their scope. Pharmacists want to become providers and things like that. I don't think it'll be that. It'll be more as the pharmacist role evolves, we'll go up with them to take care of some of those other tasks that we can do that don't require pharmacist judgment, matching things up and things like that.
Yeah, it's exciting. I know I'm learning so much about, I've never truly thought too much into pharmacists and pharmacy and all that. So it's definitely really cool. And so with your course specifically, it's fully in person, or is there an online option? For the externship, you have to be in person, but for the class portion of it.
Yes, we meet in person on Tuesdays from 9 to 1 at Quincy College campus.
Yeah.
And then we're remote on Wednesdays from 9 to 1. So that is the setup right now.
Yeah, awesome. Say my neighbor down the street is interested in this program and they've listened to this episode and it really piques their interest in everything. What are the next steps that you think they should take?
They can contact the Quincy College admission office directly, either by phone or they can walk down there. We would love to speak to them.
Awesome. And I do have one last question for you. Do you want to tell our listeners what your favorite part of being in pharmacy is?
That's hard to really narrow down.
I know, I'm putting you on the spot here.
Hard. I love introducing people to my profession. That's one of my favorite parts.
Yeah.
In my organization, I'm able to bring in employees to our organization that are going to have really great roles, maybe have been overlooked before in other roles. Maybe they don't interview very well, but that doesn't affect us. But I think that I have a lot of peers in other institutions too, and I think that being able to open the door for other technicians to join me in my profession is like one of my favorite parts.
Yeah.
I also love professional organization.
Yeah.
We just had a professional organization event at the Quincy Marriott last week, so I spent 2 days there, which was really fun. But yeah, I would say that other technicians is really my favorite part.
Yeah, awesome. No, great. Well, I have loved learning about the pharmacy tech program. Thanks for coming on, Charlotte. I am gonna go over our list for the upcoming week of events for Community Development Week. So tomorrow there is going to be a cultural dance performance, Wednesday a senior lunch, and then Thursday is going to be our big day with our Public Services Summit. Additionally, our 50th CDBG celebration, and ending it off at the Kennedy Center. So for dates and times, you can refer to the calendar that will be posted on our Facebook. Also, feel free to reach out to Rhiannon with any questions that you may have about CDBG. But thanks everyone for listening. I hope you have a great rest of your day whenever you're listening to this. We also will be at the YMCA Healthy Kids Day on April 26th. So be sure to, if you're heading over there, stop by our table and ask us any questions they may have. But I hope you guys have a great rest of your day. Thanks for listening to us, and thanks for coming on, Charlotte. It's great talking to you.
Thank you for having me.
Well, happy CD week and have a good night. Bye.